Teaching Value in Healthcare Learning Network. Join us to hear leaders in the field share practical and tangible advice about how to teach and deliver high-value care. With national concerns about rising healthcare costs, as well as overuse and misuse of medical care, Cost of Care, in partnership with the ABIM Foundation, hosts an open forum to discuss ways to initiate, implement, and sustain feasible innovations in value at your institutions. I'm Fumiko Chino. I'm the Teaching Value in Healthcare Learning Network Fellow, and I'll be moderating today's webinar. Thank you for joining us today, Anton Loman.
Hi, I'm Anton Loman. I'm the Director of Physicians Billing Office at the Faculty Practice Group at UCLA Health in Los Angeles, California.
Wonderful. Thank you so much for joining us. We're talking today about how to improve the patient experience with medical bills. And I was hoping you could talk today with just trying to review kind of the scope of the problem and why finding a solution for improving the patient experience involving billing is so important.
Sure. In 2013, UCLA Health implemented an electronic health record. We use Epic for EHR, and Epic has a billing component or a module. When we optimized the billing module, our attention shifted toward customer service and our patient billing experience. Initially, our initiatives were driven by economics. We were receiving about 20 to 22,000 patient phone calls into our billing office asking about healthcare charges or filing some grievances about certain charges. And our initial intent was to reduce the number of phone calls we were getting because that was very costly to our organization and we wanted to reduce costs. Unfortunately, at the time, we did not have the tools to understand what it was that the patients were telling us. We had anecdotal stories of what those complaints or the feedback was, but we needed some empirical data to understand what those phone calls were about so we can help reduce those phone calls. So in March of 2018, we implemented Epic's Customer Relations Management module, which is a reporting tool where we could document patient feedback and have some empirical data of what the patients were actually telling us, which then could be used to prioritize our initiatives and help reduce those phone calls.
So what I'm hearing from you is that there was a lot of patients that were very confused by their bills, and there was potentially a lack of cost transparency, which was causing some concerns on their part and a lot of unexpected bills. And it sounds like that was feeding back to you, and it was creating kind of pressure on both sides, from both the provider and the patients.
Absolutely. The first reporting we received in April of 2018 from our customer relations management tool, which gave us insight into what the patients were telling us about, it was an eye-opening experience, and we realized that we could address the economics of it, reducing the volumes of calls and reducing costs associated with management of our customer service, as well as improving the patient experience. And what we heard and saw in our reports where the patients were telling us about a lack of transparency into their out-of-pocket expenses. That was one of our major issues. So we realized that there's a gap in educating our patients, and not only from healthcare providers' perspective, but also insurance carriers' perspective. So the patients simply didn't understand what the charges were for and what their out-of-pocket expenses would be. There was complete lack of transparency.
Absolutely. I like to think of it as kind of a data-free zone. And when we think about solutions to this, we really need to, number one, just find out what the main problems are, and then eventually kind of find a solution that can work towards anticipating future problems. So with that in mind, do you mind just giving us an overview of the Patient Billing Experience Task Force and what your goals were?
Absolutely. So once we received our first reports, we categorized the different patient feedback and started prioritizing opportunities that could be addressed throughout the revenue cycle in our organization. And not only where there's patient interface in the front end when we collect co-pays or co-insurances, and in the back end where we send claims to their insurance carriers or bill patients, but we also realized that some of those opportunities lied in patient communication when they call to schedule an appointment or they come into the office to be checked in for a service, and all the way into the physician's exam room. We saw some opportunities there as well. So once we prioritized that work, we formed a committee that would review patient feedback and understand the underlying cause of adverse patient experience, which would then trigger phone calls into our customer service, and work with our partners throughout the revenue cycle, work with our physicians, our front-end revenue cycle folks, to address the root cause. Our goal was to reduce overall patient call volume by 25% over a 6-month period. And the reporting and the tools that we used and the strategy we employed helped us reduce that even greater than 25%.
That's fantastic. And I think you've really highlighted the fact that, some of these unexpected costs, from my own prior research, what we found is that it's not necessarily the cost itself, but that the fact that it was unexpected and unprepared for can really cause some downstream effects like what we've been trying to combat with the cost of care, poor adherence or decreased willingness to pay for care. And one of the choosing wisely 5 questions to ask your doctor is actually how much will this cost? And there's a lot of barriers to actually providing accurate out-of-pocket cost assessments on both sides. So I really think that what you've been doing is really fantastic and truly meeting an unmet need within healthcare.
I would even give an example of that. One of our top patient grievances we received in our customer service were related to charges associated with evaluation and management of medical problems when they initially scheduled an appointment for their annual physicals. Under the Affordable Care Act, patients are guaranteed at least one annual physical covered by their insurance carriers per year. And when they schedule and come in for the annual physical and discuss symptoms or medical problems that are outside of the services provided within annual physicals, there is a charge to the patients, and the patients simply didn't know about this. And what we did through our committee efforts was launch a patient education campaign. Scripts were developed for our schedulers when the patients call in to make appointments. Scripts were developed for our registration folks who check in patients for the service. And we also educated our physicians to have that conversation with the patients in the exam room when they discuss medical problems outside of what's covered under the ACA provisions. And that has significantly reduced patient dissatisfaction and has helped educate patients on what their out-of-pocket expenses would be. And they're able to make informed decisions about their care based on what the expenses would be.
Absolutely. When we think about shared decision making, we think about we need more information to make good decisions for both providers and patients in terms of there's a lot of lack of transparency from both sides about ultimately what patients have to pay for their care. Can you speak a little bit about how this task force was implemented, what staff or skills or material supports that was really needed within your institution?
When we received our first reports from our EHR system, we realized that the root cause and the opportunities to improve patient experience and reduce our costs were all over the organization. So from the time the patient calls to make an appointment, to the clinic check-in, to the physician's exam room, to the billing office in the back end, as well as our customer service performance. So we needed representatives from all of these areas in our organization. So we reached out to our ambulatory operations, we reached out to our compliance office, our hospital patient experience, our own billing office, some physician representation, and a very large part of this in addressing some of these issues are IT systems. Opportunities to automate certain processes that can eliminate potential errors that would also prompt patient calls into our customer service. So we also reached out to our IT services and got some representatives on the committee. And the committee meets every other week, reviews refreshed data from our CRM or Customer Relations Manager module, and prioritizes opportunities and comes up with solutions and monitors those solutions until they're in place. Then we rerun and refresh those reports to make sure that the solutions we're implementing are actually having an effect.
Absolutely. You know, I think that when we think about some of these issues with bills and some frustrations, we really think of it decreasing patient satisfaction, but I think also sometimes it decreases patient trust in the healthcare system. And, you know, in terms of the overarching mission, especially within UCLA, it's to, and within healthcare in general, it's to develop that a good trusting relationship so that people can receive the very best healthcare possible.
I absolutely agree.
Can you talk a little bit about what the benefits are for patients in terms of how the task force has rolled out the initiative and what you've seen for patients directly?
Sure. Some of the initiatives included redesigning our patient statements to make them more patient-friendly, and that's helped reduce the number of calls we get into our customer service. In other cases, educating patients about their benefits has been extremely helpful. We didn't stop at the CRM reporting. We also wanted to hear from patients directly in their own words about their experience with our billing and conducted a survey. We sent emails to our patients after they receive statements from us or call our customer service or use our online bill pay solutions and ask them to rate our service and also tell us in their own words what their experience was like. We also asked those patients who had an adverse experience to volunteer to give us their contact information. I'm a consumer myself, and I use services, online services or travel services, and sometimes I receive phone calls or emails asking me to fill out surveys. And no matter whether I'm satisfied or dissatisfied with a service, I have never received a call back. And so we thought it would be a great idea to call the patients back for service recovery and apologize in some cases if we didn't serve them at the optimal level. And I just a few days ago, I received a call from a patient saying that she never expected anyone to call her. And when we did call her, she really changed her opinion about the service that UCLA provides. And that's the level of service that we're committed to provide to our patients. We have come to a realization that good patient experience and reducing healthcare costs are not mutually exclusive. They're both in one, and we can accomplish both by addressing the underlying cause that's causing both the high volume of calls into our customer service as well as the adverse experience that the patients have.
Yeah, I think you nailed it on the head, which is if we start thinking about our patients and providers in the healthcare system all as being on the same team, that we can all work together for the best outcomes. And it sounds like that is by making some simple changes like, apologizing for when we have, potentially made a mistake, we're really engendering a lot more trust and a lot more potentially buy-in to that whole team dynamic, which is how healthcare is delivered now.
Absolutely.
Can you talk a little bit just about the next steps for you, how this program is being expanded or potentially some new action items on your future, and then maybe how this can be replicated so we can improve patient billing at other institutions?
Of course. So we have about 33 open projects as of today, major projects to continue improving patient experience. Our goal is to reduce our patient call volume by another 15% for the remainder of this fiscal year, which ends in June of 2019. I'm very much looking forward to implementing those projects. We have shared our experience with our peer organizations. Here west of the Rockies, there is a conference of EPIC users, academic and non-academic institutions, and we have presented our success and our story with our peer organizations there, and we've had lots of interest from those organizations about this initiative. And we recently also presented this at Weill Cornell in New York at the East Coast Conference of EPIC users. And we've gotten lots of interest from some organizations that are represented at that conference on our initiatives. And so we're sharing our experience with our peer organizations, and we're hoping that by learning from our experience, we can improve the patient experience across the country.
Fantastic. Are there any last thoughts you have in terms of rolling out this initiative at UCLA and kind of lessons learned or potentially mistakes that we could avoid in the future?
Yeah, well, this is going to be a work in progress. We don't see this initiative ceasing anytime soon as new opportunities emerge. Some of our challenges are constant changes in regulatory environment and constant changes in very complex patient benefits and insurance plans. And we need to continue working to adapt to the new environment. So we will continue working on this. This is a very high priority for us. Patient experience does matter to us, and reducing healthcare costs also is very important to us.
Fantastic. Well, for the Learning Network, thank you for joining us today, and a special thank you to Anton Loman from UCLA Patient Billing Office. For more of Cost of Care Learning Network webinars, please visit costofcare.org/learning-network. Listen to us on SoundCloud at Teaching Value, or follow us on Twitter at Cost of Care. Thank you.
Thank you very much.